Hello everyone and be welcome to another video to my channel Annabella as I am. For those who doesn't know me, my name is Annabella and I got a bachelor's degree in nutrition at the Semmelweis University in Budapest, Hungary. And in today's video I will be talking about kidney stones and renal failure. I will be talking about diet, prevention and treatment. Okay? But before that, if you are not yet subscribed to my YouTube channel, I encourage you to subscribe because I will be posting a lot of nutrition related content, also about wellness recipes, light recipes, international recipes. Don't forget to give this video a big thumbs up to help my channel grow. Also share this content in your social media with your friends so they can be helped as well. And you have any questions related to this topic or related to any health issue, just leave it here in the comments and I will answer you as soon as I can. So let's just enjoy together another video. So let's start talking about the kidney stones, okay? Which are hard deposits made of minerals and salts that form inside your kidneys. What are the causes of the kidney stones? The diet, okay, a bad diet, excess body weight, some medical conditions, for example, high blood pressure and diabetes, okay. Uh, Also, they can be caused because of certain kind of medications, okay, uh, and they can affect a part of your urinary tract from your kidneys to your bladder, okay? So what are the symptoms of kidney stones, okay? A kidney stone usually will not cause symptoms until it moves around within your kidney or passes into your ureters, okay? At this point, drinking enough water may be just the solution to eliminate the stone through the urine, okay? But if you start having symptoms, which may include severe sharp pain in the side and back below the ribs, pain that radiates to the lower abdomen and groin, a pain that comes in waves, okay, and fluctuates in intensity, pain or burning sensation while you urinate, okay, and other signs and symptoms which may include pink, red, or brown urine, cloudy or foul smelling urine, a persistent need to urinate, urinating more often than usual or urinating in small amounts, nausea and vomiting, fever and chills if an infection is present. So if you feel any of those symptoms, of course, you need to consult with your primary care physician so he can make the necessary evaluation assessment, okay, and then see if it's necessary another procedure. Maybe just with medications it will be solved, but maybe it will require a surgery. So what can you do concerning the diet, okay, and concerning the health conditions in order to avoid having kidney stones or kidney problems, okay? My first tip is just drink enough water, okay, because that will help for the minerals in your kidney to not crystallize, okay? So drinking enough water is a must. Okay, another thing, if you have a health condition, an underlying health condition, let's say diabetes or hypertension, okay, high blood pressure, then you need to control it, okay? You need to take the necessary medication and you need to follow the diet. There is already in my channel a video explaining a diet for people suffering from high blood pressure and also for diabetes, okay? It's very important that your diabetes, that your blood sugar doesn't fluctuate, okay? That's very important, that to be controlled uh, in order to avoid any other health problems, okay? And also you need to check with your physician concerning the medications you take, okay, in order to avoid having side effects, okay, and one of those side effects may be the kidney stones. The diabetes increase the risk of kidney stones due to the increase of the acidity of your urine, because if your blood glucose levels are high, the acidity in your blood increases as well, which in turn causes the acid levels in your urine to increase, okay? So you need to avoid having high glucose levels, okay? So have the diabetes under control. Now, Another important thing to avoid kidney stones is avoid eating a lot of proteins. Okay, exaggerating in the amount of proteins may also cause kidney stones. Okay, also exaggerating in the amount of calcium. Okay, it's very important that you have the normal intake of calcium, of minerals, and of protein as well. But many people, for example, if you would like to just lose weight, they just exaggerate in the amount of protein intake, and that may cause also kidney stones. Okay, so just eat a healthy diet, okay, with a lot of veggies, a lot of fruits. Okay, when I say a lot of fruits, it's like 2, 3 fruits a day. Okay, but you can just have like 5 servings of veggies without any problems a day. Okay, and then you need to have also in your diet cereals. Okay, that's also important, and of course you need to have like protein, and you need to have calcium as well. Okay, but just small amounts. For example, if you're gonna have a serving in for lunch, for dinner, you need to have amounts of about 100 grams, okay, let's say of the palm of your hand, okay, the serving size of a meat, which may be beef, which may be turkey, which may be chicken, okay, which may be fish, okay. Don't exaggerate in the amount of protein. Another type of kidney stones are those that are made of uric acid, okay? So in order to avoid those type of kidney stones, you need to avoid eating foods that are high in purine. For example, the alcoholic drinks, okay? You need to avoid exaggerating in drinking those beverages, okay? You need to avoid eating too much seafood and shellfish and some fish, for example, anchovies, sardines, herring, okay, cold fish. Then you need to avoid eating too much meats. And again, uh, control the amount of protein intake, okay, for example, bacon, turkey, uh, organ meats, for example, liver, okay, that's also very important. Not all, just to avoid having kidney stones, but also to avoid having a high amount of purine in your blood, which may cause also gout. You also need to control the intake of black tea, okay, because it has a high concentration of oxalate, okay, which is one of the key chemicals present in tea, which leads also to the formation of kidney stones, okay. So what teas are good in case you already have kidney stones or for the prevention of kidney stones, okay. The green tea, okay, ginger and turmeric tea, the dandelion tea, okay, and the nettle tea. Okay, so those you can just drink one of them, for example, for a couple of days and then change, okay, to other kind of tea of those mentioned. So now let's start talking about kidney failure, okay? So kidney failure occurs when your kidneys lose the ability to sufficiently filter waste from your blood, okay? So what are the causes of kidney failure? The main causes are a physical injury, okay, or a disease like diabetes, high blood pressure, or other disorders, okay? So kidney failure doesn't happen overnight. So it's the end result of a gradual loss of kidney function. What are the symptoms of kidney failure or that something is wrong with your kidneys? A change in how much you urinate, okay, it may be that you urinate a lot or just in a small quantities, okay. Pee that's foamy, bloody, discolored or brown, pain while you urinate, swelling in your arms, wrists, legs, ankles, around your eyes, face or abdomen, restless legs during sleep, joint or bone pain, pain in the mid-back where kidneys are located, or for example that you are tired all the time. Another causes are, for example, the use of aspirin, ibuprofen, naproxen sodium or related drug, okay, liver failure, infection, heart attack, heart disease, and blood pressure medications, okay. So again, the most important thing is just to have your, if you suffer from a disease, to just have this disease controlled, okay, or treated in order to avoid having kidney or other health problems. Now let's talk about the diet for people suffering from kidney failure. So let's talk about why is it important for having a kidney-friendly diet, because it will help protecting your kidneys from further damage, okay? So limiting certain foods to prevent the minerals in those foods will help to avoid building up those minerals in your body, okay? So what are the basics of a healthy kidney diet? Okay, you need to track, okay, some kind of nutrients, for example, calories, protein, fat, and carbohydrates, okay? So it's also very important to just control the sodium intake, okay? So that means the salt intake, which means avoiding processed foods, avoid eating bacon, okay? Avoid eating canned food, okay? Avoid eating chips and a lot of foods that just have a lot of salt content. Even you need to um, pay attention to the salt content, for example, of bread, of cakes, of cookies, of everything that you just eat. You need to pay attention to that and reduce the sodium or the salt intake, okay? You also need to pay attention to avoid eating a lot of proteins, okay? So what foods have a lot of proteins? Meat, eggs, poultry, okay? So you need to avoid eating a lot of that. Your body needs protein, but you need to avoid eating a lot of them. So for example, you need just to have a little bit of protein in your main foods, which would be, for example, breakfast, lunch, and dinner, limiting the amount. You need to talk to your doctor, okay, for him to tell you exactly the amount, but it would be of about 60-65 grams of protein, okay, in those main meals, okay. Then you need to limit also the intake of potassium, of phosphorus, and also of fluids, of liquid, of water, okay. So potassium is a mineral found in almost all foods. Okay, so but when your kidneys are not working well, your potassium level may be too high or too low. Okay, if the potassium level are too low, then probably you will need to have more intake. You will need more intake of foods which are rich in potassium. Okay, but if you have too much or too little potassium, you may feel muscle cramps, problems with the way your heart beats, and muscle weakness as well. Okay, so what foods are just low in potassium? Apples, cranberries, grapes, pineapples, and strawberries, cauliflower, onions, peppers, okay, pita, tortillas, and white breads, beef and chicken, and white rice. So what are the foods that are high in potassium? Avocados, bananas, melons, oranges, prunes and raisins, artichokes, winter squash, plantains, spinach, potatoes and tomatoes, brown products and granola, and beans, okay, and brown or white rice. So your doctor will need to tell you exactly how much potassium you will need a day, and then you will need to have a personalized diet, a customized diet, okay, for your case. So concerning phosphorus, okay, it's also you may need to limit the amount of phosphorus in your food, okay, in your food intake in your meals. So what kind of foods are lower in phosphorus, okay? Italian, French or sourdough bread, corn or rice cereals and cream of wheat, unsalted popcorn, and some light colored sodas and lemonade, okay? So which are the foods that are high in phosphorus? Whole grain bread, brown cereals and oatmeal, nuts and sunflower seeds, and dark colored colas, okay? So you will need again to talk to your doctor so he can refer you to a dietitian which may prepare a diet adjusted just for your case. Okay, these tips are just general tips, okay, and it's very important that these are just kind of a guideline for you, but you will need to consult your physician, okay, and have a personalized diet made for you, okay. So concerning fluid intake, so again, fluids are very important, but if you have a kidney damage, okay, You don't want to have a lot of fluid intake because your kidneys will not be able to get rid of extra fluid as well as they should, okay? And if having a lot of fluid accumulated in your body can be dangerous, which may cause high blood pressure, swelling, and also heart failure, okay? So maybe you will have your uh, fluid intake limited to about 5-6 glasses of um, fluids a day, okay, which may be difficult. So what can help you in order to be able to just have this amount of fluid intakes? Chewing a gum, for example, rinsing your mouth, suck on a piece of ice, mint, or hard candy, okay? But in case you have diabetes, you need to choose those that are sugar-free, okay? And again, you need to count also the soups, okay? And you need to count everything you drink and track it, okay, in order to avoid any problem. So these were my general tips. I really hope these tips will help you, okay? Again, just as a guideline, don't forget to consult your physician to just adjust these tips, and also the physician may give you other kind of tips in order to have any disease, and in this case the kidney disease is controlled, okay? And I wish you a lot of health, a lot of blessings to all of you, and see you in my next video. Again, don't forget to give this video a big thumbs up if my tips helped you, and to share this video with your colleagues in your social media. See you next time. God bless you all. Bye bye.